Your original hometown dealer, Saida, Trudeau Chrysler Jeep Dodge and Ram.
Quote, we are in a very dangerous place due to the current extremely high COVID baseline and limited hospital capacity. A further post-Thanksgiving surge will compromise COVID patient care as well as medical care overall. The rate of COVID spread is increasing in Nevada. Engage local leaders to demonstrate the effect growing cases will have on hospitals and overall patient care if Nevadans don't change their behaviors. All states and counties must flatten the curve now in order to sustain health systems both COVID and non-COVID emergencies need. New orders put in place by the governor should result in a rapid decrease in transmission if compliance with those orders are high. To summarize, if directives and mitigation measures were followed over Thanksgiving and continue to be followed, the White House believes we should see a decline. One more time, these are directly from the White House. So if you aren't inclined to believe me, hopefully you'll listen to them.
The governor went on to introduce Shannon Bennett, Nevada Department of Health and Human Services Immunization Program Manager, who explained the tiered distribution of the vaccine.
Our framework of priority populations begins with those at the highest risk for contracting COVID-19 and those who we are all depending on to take care of us, our critical infrastructure workforce in hospitals and medical facilities. Tier 1 also includes other medical provider types, correctional facility staff, and law enforcement. Of this first vaccine allocation, a portion will also be set aside for CVS and Walgreens, our pharmacy partners, who will work to vaccinate members of our vulnerable population who work and reside in long-term care facilities.
Due to expected side effects of the vaccine, most likely a sore arm and low-grade fever, not all Tier 1 recipients will be vaccinated at the same time. This will help to ensure that these side effects will not place staffing shortages in these essential areas. The governor concluded the press conference with recommended safeguards reported by the White House.
The COVID risk to all Americans is at a historic high. It must be made clear that if you are over 65 or have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked due to the immediate risk to your health. You should have your groceries and medications delivered. If you are under 40, you need to assume you became infected during the Thanksgiving period if you gathered beyond your immediate household. Most likely, you will not have symptoms. However, you are dangerous to others and must isolate away from anyone at increased risk for severe disease and get tested immediately. If you are over 65 or have significant medical conditions and you gathered outside of your immediate household, you are at significant risk for serious COVID infection. If you develop any symptoms, you must be tested immediately, as the majority of therapeutics work best in early infection.